You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, he says you can get a fixed set of teeth, a full arch of teeth in just a few appointments. With us, we have board-certified periodontist Dr. Guzman. Dr. Guzman, welcome.
Hi, Randy. Thanks. Pleasure to be here.
Now, you have, I guess, one of the largest practices in the town you're in. Is that right? It's a big group practice?
Right, right. Well, we have a full-service group dental practice.
Okay.
You know, we have 9 specialists, general dentist, and 7 dental hygienists.
So who is the typical patient? And specifically, what are the different procedures that you do?
Well, being within a group allows us to provide services ranging from all the way from, for example, within cosmetic dentistry, we have ceramic veneers, we have full porcelain crowns, we have the CEREC system that allows us to do 1 appointment crowns.
Like crowns in a day, right there?
Crowns in a day,
okay.
Exactly. Very, very convenient. And then also we do all the way through, you know, smile makeovers. Now this has become a lot more predictable once we were able to establish our own dental lab. So we have
you know, a lab right there on site.
Yeah, it's DPB Ceramics. We have a master technician and CAD/CAM technology that allows us now to handle restorations from the beginning all the way through the end. So we can predict and establish the standard of care that our patients have gotten used to.
So it's faster, by the way, by having it right there, less trips to the dental office?
Oh, no question.
Because nobody likes going to the dentist, right?
Right.
Do you hear that still?
We do it
no
every day.
Doctor?
We do it every day, exactly. And that's really what it's all about. It's not only, you know, a lot of things that we created for convenience, then we have realized the fact or just because we're together and we do it all the time and it's just the same, these systems and protocols become so everyday thing that it's just a lot more predictable results. You know, patients are, you know, basically living with beautiful smiles all the time, less number of visits, less discomfort. You know, for example, I mean, we were talking about earlier that I used to work actually in a different setting. When I was a periodontist, you have, you know, hopefully 50 or 100 referral dentists sending you patients. You know, you have to have these multiple appointments. You know, then the dentists have to meet.
This is before you owned your own practice.
That's right. So 10 years ago, when I used to work for someone else, you know, we had a number of referrals that we not only the patient had to visit different practices in different days. First of all, it took a lot longer because you got to take the time to fit everyone's schedule. But then now, as a dentist, we have to get together and discuss those cases and so forth. So initially, my initial vision was like, we have to put this together. Of course, you start thinking about convenience. You know, how can we get this under the same roof? How can we do it all in one single place? But then you realize that your results are becoming a lot better. Not only a lot more predictable, we are able to now tell a patient, you know, from how many visits they're going to take, but we also know the cosmetic outcome, how much function, when to see us back. It's all in a single sheet of paper, a single office, a single.
So when you were working for someone else, I mean, you pretty much said, look, I want a different kind of practice.
Well, the main issue is that when I had the ability to work with excellent dentists around the area, but also I had to deal with some not so experienced.
Now I interrupted you. Back to the different procedures you do.
Right. So, well, because again, as a group, we are able to, for example, we provide orthodontic services. Okay. We do the Invisalign by an orthodontist. We have adult orthodontics. We do microscope root canal.
So what is that?
So it's microscope assisted root canal. So basically, it not only makes it easier in a patient because it's a single appointment root canals nowadays, but also the longevity of a root canal it's based on how accurate the fill on the tooth is. So it's a little technical, but basically because we're able to see much more within the tooth, it makes it a much more predictable outcome as well.
And root canals, by the way, are known as being the worst procedure.
I know, there's a big myth about it.
Why do you smile about that? There's a myth?
Because a lot of people, yeah, that root canals should not hurt. I mean, it's actually very seldom that there is a problem with it. I mean, so we have many patients that actually are surprised by the experience that they go through because we don't see that. I mean, you know, we have, for example, in our office, Dr. Goldberg is he's been doing root canals for 30 plus years. And again, we have patients coming over and over, even though they move away. They still travel back to Boston because, again, it's just how the type of experience.
But does it cost more, like we're talking about dental implants today, to go to a specialist?
It is a good question. I believe that it...
Because general dentists can do this.
That's right. Well, the short answer is no, it doesn't. So the key here is to go to someone who has the experience and the ability to offer different options. I mean, you should not be just kind of limiting yourself to go to a single procedure doctor. You got to go where you have the whole array of treatment options. In our practice, we do implants every day. So this is something that, you know, is not out of the ordinary anymore. I mean, we have patients that are coming from either a single tooth, you know, someone who were just told that a single tooth has to be lost, or maybe they've been missing it for a little while. We have patients probably missing, you know, 2 or 3 teeth where a couple of implants would do. Also patients who have gone through another dentist and they've been told that all the teeth have to be lost. You know, they have a schedule, they have a type of job that does not allow them to be without teeth at any point. So we are able to provide them with an immediate solution where they walk in.
So they're going with no teeth?
That's right. They walk in and out and they have teeth at all times in a fixed manner. So they're not removing teeth at night, they're brushing their own teeth in the mouth.
Nice.
Also, then we have to, you know, patients who unfortunately have been missing the teeth, and usually we divide it, you know, patients who have been missing teeth for 5, 10 years, where there is still some residual bone that is a simpler, you know, we have the ability to do a number of implants that is going to allow them to have a fixed rehabilitation.
So with the denture wears, which is what we're talking about today, is that becoming a very popular procedure?
Yeah,
in
definitely.
your practice?
I mean, we do have direct requests. I mean, they are either through media or friends. You know, they know that either 2, 4, 6 implants, they are able to find, you know, fixed solutions. So
like a fixed set of teeth.
It is changing their lives, yeah. So they're back to being able to eat stuff that they couldn't eat before. You know, they have good steak.
Do they tell you these stories of what they're eating?
Oh, every day, every day. They, you know, apples. Finally, they're, you know, stuff that corner of the cup. Stuff that they stop eating for, they literally forget what they're missing. They didn't know, you know, they've been wearing denture for so long that it's just a whole different, it's a whole different lifestyle.
Let's talk about your background and training, briefly, and then how you got involved in dental implants.
Well, basically, I mean, I went to Boston University. That was about 15 years ago that I graduated. And so I have always been interested into, you know, simplify the process. So then I got interested into reducing or addressing the limitations that old dentistry, that old implantology was offering. You know, it was taking us too long to replace teeth. It was taking us too long to replace the function. Now people are on the same day able to, again, chew back to this, eating the steak, chewing into, biting into an apple. So it's really the
So this same day concept is real? Because I always think it's the same, a bit of an exaggeration.
It does happen every day. You know, it's, and it does vary. I mean, some patients, again, you don't have to have, there are several myths in dental implants. I mean, we're talking about, you know, is it, well, first of all, am I a good candidate? Do I have enough bone? Is it going to hurt? How much is it going to cost? So there are a multiple array of options where, you know, probably as we're going to see, 2 implants are going to be enough for you to have a whole different experience with your denture.
Like a full arch of teeth with just 2 dental implants?
Well, a full denture that is removable, that is ill-fitting, that it goes, that doesn't let you smile, doesn't let you laugh. Now with 2 single implants, it becomes a much steadier option, which now it literally clips on, and now you're able to function a lot more, you know, comfortably.
Okay, good. So you believe that. At the top of the show, we said no more dentures. That'll be, I mean, the way we know dentures today is not going to be in the future?
I think we are in the right track. I mean, as we said earlier, a lot of people, patients are walking in already through media, TV, radio, patients, I mean, you know, media like yours, already asking for other options. They hopefully going to learn soon that dental implants are going to change the life experience. So hopefully, yeah, that would be my expectation.
So why is it what used to take you guys when it comes to dental implants, like 6 months, 9 months, now can happen same day or a few visits?
That's true. I think dental implants in the last 10 years, they have changed dramatically. I mean, we have learned about not only wound healing, you know, the form of the implant, we have learned about, you know, we understand better how things work. So what we used to see, again, coming from an orthopedic protocol, that we would have to bury an implant for 6 months and then again uncover it and then wait another 3 months, and then it was taking us a year and a half to actually literally be able to load an implant. Today, those patients are literally, the tooth comes out, the implant gets placed, and the tooth goes on the same day. The patients are walking and eating on the same day.
I had a medical doctor, by the way. This is no kidding, from Palm Springs, California. And great shaped guy. He's in his, like 51 years old. He goes, because I told him, you know, we just had a doctor talking about dental implants. And he said, yeah, I have one. He goes, I have another 3 months to go.
Right.
Before.
Right.
So it makes me realize that people are still doing it that old way.
Well, we have it all the time with,
right?
with husband and wives. We see it with spouses. Because we're in downtown Boston, we have a lot of people that work there, and then let's say they live in the suburbs. So they start comparing between spouses, and they say, listen, my spouse is, she's taking 4 months, how come? So often I have spouses.
So training of the doctor then?
It is probably being part of that's a tough one.
I know you want to be nice and politically correct here,
yeah,
but is it the training of the doctor? Obviously, a philosophical
They got to catch up. No, I mean, it's lack of. That's really what it is.
Okay.
Another reason why they're also faster nowadays is because of imaging. For example, we have the cone beam CAT scan at the office that allows us to see not only the anatomical features. Years ago was almost a blind procedure. Like, well, we open it up.
So when you say open up what?
Well, it was a much more invasive procedure. We have to literally create incisions on the gums, flap the gums apart, and then find through the clinical procedure how the anatomy of the bone was. Do we have enough bone? Do we have enough gum around it? So now at the office, we have the ability with the cone beam CAT scan to not only, of course, assess the anatomical features that we're going to, is going to prevent us from creating a problem, but also we can treatment plan the whole case. So before we go into the patient, now we have a shorter procedure, so it's going to take us a
less cutting of the gums.
Oh, not only, and then literally they're walking out with either flapless procedures, so not is faster, but it's a lot less invasive. So for
some
example,
people get no stitches?
Not at all, no stitches at all. Not only that, like we have actually a good colleague of mine, his dad was probably 93 years old. He finally, as a dad of a dentist, the dentist keep pushing the envelope and we're doing the bridge, we're doing this, and trying to get him away. Ideally, as I was telling him, I wish we got him 20 years earlier so he wouldn't suffer the last 20 years. Well, finally in 93, we said, listen, we can't do this anymore. Now, he was concerned, he had some heart conditions, he had other issues. So with this process, literally you do a flappers procedure, it takes under an hour to do it, and he was perfect. His dad actually could not believe it. I mean, he started calling me his son. It was really an amazing experience because finally he changed. And he started asking me why we didn't do this. Of course, not me, but asking his son why you didn't talk about me, about this 20 years ago.
So the 93-year-old was going to either have dentures,
right,
or like a fixed set of teeth, or what?
So for his dad, we were able to place 6 implants in a flapless way under an hour, and he literally got an immediate temporary that he felt a lot better on the same day than 20 years ago.
Now those come in and out?
No, there's
so a fixed arch of teeth.
It's a fixed arch of teeth.
But at 93 though. I mean, that seems very painful.
Not at all. First of all...
So he didn't complain about pain?
We have, 93, I have patients that are already 99. I've done probably...
Why would a 99-year-old want to do this?
Because they don't want to be with no teeth. They want to have the same confidence. They really... Listen, if I had my teeth until I'm 99, why am I going to not enjoy my last 5 or 10
years? Are they more
years?
likely to fall out at 99?
No, not really.
Age?
Not statistically. I mean, when we look at evidence-based dentistry, what we need to do sometimes is, through imaging, we are able to see the density of the bone. So sometimes if we have softer bone, we have to wait a little longer. Okay. But that could happen at 93, it could happen at 62. There are things like smoking and other things that would make your density of the bone a little softer. So there are clinical decisions to make it. That's why you got to be, or going to somewhere who's experienced and does this all the time.
So this 93-year-old can eat, chew, whatever he wants.
It's not only that, but they don't have to see, they can smile, they can laugh again. They don't have these ill-fitting dentures.
So in Boston where you are, how big of a problem is it? I mean, how many denture wearers are there? Because I don't see that there's that many people wearing dentures.
Oh, it is. Listen,
really?
I actually looked that up before because we talked about it earlier. And, the greater Boston area is about 4.6 million people. That makes it the 10th largest population. We got over 250,000 patients with at least one jaw with no teeth at all. I mean,
wow, it's a lot of people.
It is a lot of people, and
so within probably 10 minutes of your practice, you've got tens of thousands of people with an upper lower denture.
That's right, but a lot of them they don't even know about these options.
But if it's so good, right? Why isn't everybody doing it? Why aren't all these denture wearers coming forward?
That's right, and I think part of it is first of all, patients with dentures, they don't go to the dentist. And because they don't go to the dentist, they don't know about their options.
Okay.
Also, I'm sure that there are people who have, carry on with this myth about, is it going to be too expensive? Am I a good candidate? Do I have enough bone? All these things that are taking people away from the dental office and, again, being exposed to the potential options.
But it seems very painful, though.
Well, you know what? A lot of our patients...
Is that one of the fears?
It is clearly, but most of our patients are surprised of how easy this is. And, biologically, there are no nerve endings in the bone. So it's not a matter of most of the pain comes from the injury of flapping the gums, cutting the gums, lifting the gums.
Good point, okay.
Nowadays, though, we have the ability to do either flapless or minimally invasive procedures, the pain is not there anymore. I mean, again, a lot of our patients are happily surprised of how easy this was. You know, maybe a couple of ibuprofens a day, something that 3-4 days later is a lot more manageable.
Is that right? Okay, so let's move into the options for denture wearers. A denture wearer is watching this. What's the entry level? You brought models.
Right. So we got a couple of examples here. For example, this is the one we were talking about. We have, for example, look, and I wish you could try this out because the stability of a denture
take a look at
really,
this.
yeah, look.
Okay, so this is a full arch of teeth right here.
That's right.
Okay,
you got the
supported
same
by-
denture that you have
So
two
two
implants.
where? Where do you put them?
The interesting part is that this is probably the safest area to place an implant. You got no anatomical feature, no nerves, no blood vessels around this area, and you have the strongest bone.
Okay, so right here, so this is and there's little snaps underneath
That's
here.
right.
If they could see
it's
this.
a female-male attachment
So
that
you
you
go right
literally
here.
just clip it on.
Very
That's
nice.
it. Yeah, it works well.
Do you show that to patients?
I do. You know, this,
And that seems very snug. To some people, they can't even take them out?
we
'Cause it seems
actually
like that.
have to loosen them up. They have different O-rings, just like.
But what about the back? They flip up? I mean, there's no more adhesive with that.
That's right. No adhesive. Again, it's a much better than a regular denture, but it's not still a removable appliance. So that's when we have two
So
additional
that's the
implants.
first option.
So we actually have also the option of adding more implants. You could do probably 4, or you could do 6. I mean, there are people
For
actually.
snap in, snap out.
Yeah, they do it like, for example, a bar. You know, large metallic bars. We really, I mean, by the time you get to 4 or 6 implants, I think you could now offer a fixed option. So
When you say fixed, that means teeth that don't come in and out of their mouth.
Yeah, they
Nice.
brush their teeth. They could chew on them.
Do you have one of those models for that?
Let me show you this, because this is probably what everyone else will like. I mean, everyone who's wearing a denture, I mean. You know, now with 4 implants, we're able to have a fixed bridge. I mean, this I removed the screw so I can show you. But you have 4 implants where literally now there's no clip on. You literally place them in. Now the dentist will screw this in and patients are chewing, eating, laughing, smiling with this. So the main issue is 4 single implants. Now you can have a fixed solution.
Same day?
Same day. You could, now what we do is, if there's extractions, you could literally do the extractions, place the implant on the same day you're walking out with fixed temporary dentures. So the next level up.
So there's a next level up from
Well,
having a fixed set of teeth?
There's everything for a different budget. So here is, you know, when we do this all on 4 or 4 or 6 implants for a fixed solution, these are denture teeth.
So it's like a denture that's fixed in there.
That's right.
Okay.
That's right. Now you could do this in a ceramic way. Now, again, nowadays through CAD/CAM technology, it's amazing what we could do. This used to be a large piece of metal, basically just holding porcelain. Today, this is a full ceramic. This is something that
So
is
like veneers.
completely. And then it looks
Interesting.
more natural. And the best thing, though, it will last a lot longer. Probably a bridge in denture teeth, you're talking about probably 15, 20 years. Now you're looking into 40, 50 years with ceramics. They don't
So these
stain,
are like, they don't stain.
they don't change.
So what about brushing and things like that?
Well,
What's
like
the maintenance on these?
the main issue, though, is, of course, we will recommend our patients to continue to see us. They're just patients like back to teeth. They have teeth.
So like every 6 months?
Twice a year, yeah, at least. At least. We often have patients in 4 months recalls. You know, we want to see anything that you get early on is a lot easier to fix.
And with that fixed set of teeth, I mean, you are back to
probably 95% function. You're able to, again, back to chewing anything you want, dating, kissing, laughing, anything. I mean, it really changes. I mean, we have patients who have come from, you know, not believing, you know, getting into our office, tearing up, embarrassed to open their mouth. You know, we took some digital fixtures every time just to, to kind of realize where we want to go with the plan. And the initial session is a difficult session. They're embarrassed. They don't want to show it. They think that this is the worst. Oh, Dr. Guzman, you haven't seen this. You got to get ready.
These are people that need extractions.
That's right. Yeah, most of the times our patients, exactly, with multiple teeth, they've been told years ago that teeth have to be removed. Now, the last session, when we're done and we're talking new pictures, they're all smiling, how many
What
more?
if your gums are too bad? See, I've had people even tell me, because you know, after talking to you,
Right,
different
right,
guys, I
right.
say, you should consider dental implants. And somebody said to me, which is a good point, my gums are bad.
It is interesting because the disease, or the gum disease, the reason why you get puffy, bleeding, abscess, and all that stuff is because of the teeth. Once you remove the teeth, the disease goes with it.
The gums get healthy?
It does. They completely. The bone, you know,
interesting.
your immune system, your ability to repair and heal, it's going to create a good foundation. Again, it has to be controlled, it has to be maintained, it has to be watched, monitored. But we today believe that the prognosis, the future of a dental implant, a tooth on top of an implant, will probably last longer than a tooth or a crown.
This is good stuff. I mean, we are out of time completely. But final message, though, to the denture wearer, to the person that thinks their gums are too bad or their teeth are falling out.
Right.
What do you say to them?
What I would say is come in, learn your options. They got nothing to lose. I mean, what else? I mean, it is going to change their life. So I would say just take their time, pick up the phone, make a consultation appointment. We'll take it from there.
And insurance, we should mention. I guess here in the United States, even in Canada, dental implants aren't covered, but you'll work with them. Is that right?
Oh, you know,
financing available.
We will find a way. Again, exactly. I think that's the better way. We have to come up with a realistic plan. Our goal is that every patient comes out with something that is going to worth something. We don't want you to say, "Well, thanks a lot. I'll call you next year." This is something that we're going to have an array of options. We have a way. You know, we have a couple of people, great staff that is going to help you out with financing and you know, going from our in-house financing all the way through third-party financing.
Is this one of those things that when it's all done, the denture wearer, when they go into obviously a fixed set of teeth, they say, "Doctor, I should have done this years ago"?
Randy, let me tell a story. I think there is this woman, actually beautiful face. I could, you know, she's actually way too young to be wearing dentures. Unfortunately, she's about, you know, a little less than 50.
Okay.
She was struggling. It was a few years ago. It was, you know, she was blaming the economy. She was blaming, I think it was all the issue about self-esteem. We finally got her into fixing dentures, and within, I believe, 3 or 4 months, she found a job. Now, she's a whole different person. She has gone up. This is about 2 years ago. Her whole career changed. It's a whole change just because of her confidence. I think that she felt that now she was worthy of more.
So this person, like 48 years old, it's wearing dentures. It's hard to believe that people that young are wearing dentures.
It's unfortunate. You know, it is, 48 is way too young. But, you know, any age is too young to wear a denture. I mean, why would you wear a denture? Now we have dental implants. We have to get rid of those.
So that's your message.
It is. Come
Wipe
in.
out dentures in Boston.
That's right. Dental implants. That's what we got to do.
Does it cost more, like we're talking about dental implants today, to go to a specialist?
It is a good question. I believe that it...
Because general dentists can do this.
That's right. Well, the short answer is no, it doesn't. So the key here is to go to someone who has the experience and the ability to offer different options. I mean, you should not be just kind of limiting yourself to go to a single procedure doctor. You got to go where you have the whole array of treatment options. In our practice, we do implants every day. So this is something that, you know, it's not out of the ordinary anymore. I mean, we have patients that are coming from either a single tooth, you know, someone who we're just told that a single tooth has to be lost, or maybe they've been visited for a little while. We have patients probably missing, you know, 2 or 3 teeth where a couple of implants would do. Also patients who have gone through another dentist and they've been told that all the teeth have to be lost. You know, they have a schedule, they have a type of job that does not allow them to be without teeth at any point. So we are able to provide them with an immediate solution where they walk in.
So they're going with no teeth?
That's right. They walk in and out and they have teeth at all times in a fixed manner. So they're not removing teeth at night, they're brushing their own teeth in the mouth.
Nice.
Also, then we have to, you know, patients who unfortunately have been missing the teeth, and usually we divided, you know, patients who have been missing teeth for 5, 10 years, where there is still some residual bone that is a simpler, you know, we have the ability to do a number of implants that is going to allow them to have a fixed rehabilitation.
So with the denture wearers, which is what we're talking about today, is that becoming a very popular procedure?
Yeah,
In
definitely.
your practice?
I mean, we do have direct requests. I mean, they are either through media or friends. You know, they know that either 2, 4, 6 implants, they are able to find, you know, fixed solutions. So
like a fixed set of teeth.
It is changing their lives, yeah. So they're back to being able to eat stuff that they couldn't eat before. You know, they have good steak.
Do they tell you these stories of what they're eating?
Oh, every day, every day. They, you know, apples. Finally, they're, you know, stuff that corner of the cup. Stuff that they stop eating for, they literally forget what they're missing. They didn't know, you know, they've been wearing dentures for so long that it's just a whole different, it's a whole different lifestyle.
Let's talk about your background and training, briefly, and then how you got involved in dental implants.
Well, basically, I mean, I went to Boston University. That was about 15 years ago that I graduated, and so I have always been interested into, you know, simplify the process. So then I got interested into reducing or addressing the limitations that old dentistry, that old implantology was offering. You know, it was taking us too long to replace teeth. It was taking us too long to replace the function. Now people are on the same day able to, again, chew back to this, eating the steak, biting into an apple. So is really the
So this same day concept is real. Because I always think it's the same.
It is
bit
real.
Of an exaggeration.
It does happen every day. You know, it's And it does vary. I mean, some patients, again, you don't have to have it. There are several myths in dental implants. I mean, we're talking about, is it, well, first of all, am I a good candidate? Do I have enough bone? Is it going to hurt? How much is it going to cost? So there are a multiple array of options where, probably as we're going to see, 2 implants are going to be enough for you to have a whole different experience with your denture.
Like a full arch of teeth with just 2 dental implants?
Well, a full denture that is removable, that is ill-fitting, that it goes, that doesn't let you smile, doesn't let you laugh. Now with 2 single implants, it becomes a much steadier option, which now it literally clips on, and now you're able to function a lot more comfortably.
Okay, good. So from the time they show up to your office, how soon could you tell them you can do it?
Oh,
that they're candidates?
On the same day.
Same day.
We have everything needed to have proper diagnostic tools. Now, being a candidate and being explained through the options is a different step. To tell the truth, I don't remember one patient who I have told, I'm sorry, you cannot have dental implants. So it is a very unrealistic expectation. I think everyone could have dental implants. So we just got to find a way to best provide that service to them.
So thank you for coming on the show. Good stuff. So they could go to your website.
Oh, definitely. Listen, there's a lot of information there. They could definitely call the office. They could ask for Kelly. Kelly will pick up the phone.
Do they get to see you if they wanted to?
Of course they will. I'm the one. I'm going to be there.
You do the dental implants there?
I will be, yes.
Okay, good. Thanks again.
Thanks a lot. It's been a pleasure.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, let's just say you caught the last 10 minutes, go to wellnesshour.com, put in Dr. Guzman. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.